Hi, I'm Jennifer Sikorskas. I live at Revesby Heights. I have 2 children, 2 girls, and I have 5 grandchildren.
And what brought you here today?
My daughter Kate, who is a kinesiologist, and she wants me to have a look at how things are run, because quite often I take things a bit too lightly, and she just wants to see if Philip can help me.
Okay, what have you been taking lightly?
I've been taking things like anxiety and my arthritis and things like that. I take as that's the way it is and it can't be fixed, and she wants me to know that yes, it can be fixed and he can help you.
So if you do get some good results today, what sort of impact would that have on your life?
Particularly for anxiety and depression, it would be something that maybe I could go off my medication, and also with my arthritis, I have it pretty much, well, I used to have it in the knees. I've had 2 knee replacements and I've got it in both shoulders, and that would be wonderful if I could move them along a little bit better than what they are moving at the moment.
Do you have any pain as well as?
I have pain in my shoulders. I've just had a shoulder operation 2 weeks ago and had all the arthritis burred off, so it's very sore at the moment. So I don't expect him to do that much with that shoulder because it's it's just had an operation, so it's had a lot of trauma to it. But hopefully he can do something so that my movement is better.
So on a scale of 1 to 10, how impacted and affected is your movement?
I would say probably about a 7, 6 or a 7, because I am on medication for it.
Okay.
Yeah. But if I wasn't on medication, I wouldn't be able to walk or. Yeah.
So you've and tell me about the taking things lightly.
Mm-hmm.
Is that just
That's just a mother's do, I think. I think, you think that you can get through everything and do it and just disregard it, and sort of not think about it too much. Because I think if you think about things too much, it becomes a burden on you, and I try not to do that. And I think that's also with the depression as well. Yeah.
And I'll just get a time frame from you. How long have you been?
I've had it for about 25 years now.
The depression?
No, not the depression. I did have depression when I was younger, but I've only been on medication for depression now for probably about 10 years.
Okay, so the pain and lack of movement came first? You had that
yes.
for 15 years?
Absolutely, yeah, absolutely. And then I think that goes into depression because you think to yourself, how am I ever going to get myself out of this? What am I going to do? I'm going to be bedridden, I'm going to do this, da-da. And I think that's where the depression comes, because you can't do things like you would like to.
It was life-changing. I've had 2 knee replacements, and I still get pain in my knees, but I just thought that was part of it, and I have no pain now. It's just amazing. I was just very emotional. I couldn't contain myself because it's and I think that's got a lot to do with my depression and my anxiety as well. And hopefully if I can get that pain under control and it stays the way it is, it's just life-changing.
And all this time?
All this time. I didn't believe my daughter, which I could hit myself with, but sometimes the family's too close. And I'm really amazed. And I was amazed about that girl that just walked in then, because she was really dragging her foot, and now she can just walk properly. It's amazing. Just amazing. That's it. That's all I need to say.
Yeah. Yeah, beautiful.
Mm-hmm.
Yeah, I can't think of anything else to ask you.
No, because it is. It's life-changing, and that's, now to know that I can walk and do things without having to, walk 20 metres behind my husband when he walks and things like that. Hopefully that, that will change now, and I'll be able to live a, fairly fulfilling life, and travelling overseas like I want to do, and which I have done, but it's always been a bit of a pressure on me. getting up and walking around places and doing things, and now hopefully I'll be able to enjoy all of that and much more.
Yeah.